Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over thoracic outlet syndrome. So what is thoracic outlet syndrome? It is when you have a compression on the brachial plexus, which is a nerve bundle that feeds the arm and supplies the muscles in the arm. So if you get numbness or tingling into your hands, and specifically, it's going to, if it's the median nerve that's being compressed, then it's going to be a symptom of numbness and tingling in the first 3 digits. So you've got your thumb and then your pointer finger and your middle finger, and it's going to be on the palmar side. So on the hand side, you can get some numbness and tingling, and then on the tips of the back side of the fingers. Thoracic outlet, what is that? That's the space between your collarbone and the first rib. So there are going to be 2 muscles that usually will compress that nerve bundle and result in those symptoms. And it can be really uncomfortable in the arm, and it just follows the pathway of the arm down into the finger. So if you get numbness, tingling, discomfort in the arm, pain that goes down the arm into that area, that is thoracic outlet. You do want to consult your medical doctor or physical therapist for the appropriateness of exercises for you. You do want to make sure that none of the symptoms are coming from the neck. That could be something a lot more serious that needs to be addressed. So usually it occurs from one of 2 muscles or possibly both. But it's going to go through the scalenes. So your anterior and middle scalenes, those are going to attach from the front of the neck down into that first rib. And between the anterior and middle scalene is where you're going to have the median nerve bundles that are going to go through there. And then it can be compressed from the pec minor because it's going to travel underneath the pec minor to feed the arm. So I'm going to release and stretch those 2 muscle groups, and then I'm going to do what you call nerve glides and flossing of the median nerve, and I'll show you how to do that. So we're going to release, we're going to stretch the scalene muscles, the anterior middle, the pec minor, then we are going to, after we release them, stretch them, and then we are going to floss the nerve, or we're going to mobilize the median nerve. So the first muscle that I'm going to release is going to be my pec minor. That muscle is attached from the coracoid process, which is part of the shoulder girdle. So if you find your collarbone and go out to the very edge of the collarbone, you drop down and you can press back in there. And usually it's really tender, so you want to be mindful of the pressure there. But that is where your pec minor is going to originate, and then it's going to attach into ribs 3 through 5 in the front side. So it's going to be on the outside of my chest wall. What I'm going to use, and you can use a baseball, you can use a softball, a tennis ball. I'm going to use a lacrosse ball, and I'm going to place that right over that muscle. I'm going to use a wall to apply pressure. So when I stand in the wall, I'm going to place the ball right where the pec minor muscle is. I'm going to lean my body, and I want to turn my head opposite direction. So I'm going to turn my head to the opposite direction, and I'm then going to take my palm and turn it so it's towards the wall, and I'm going to move my body side to side. So I'm going right over that pec minor. And if I have an area of tenderness, I'm going to hold right there. So what I've done, I take the lacrosse ball, I'm going to apply pressure up against the wall with my palm facing towards the wall, and then I'm going to slowly go side to side. So I'm going slightly at an angle, but just going across that pec minor muscle so I can release the tension in the fascia and the muscle of the pec minor. After I release the pec minor, I'm going to stretch that muscle, and I'm going to stretch it by doing a Y stretch in the corner. So it looks like this. My arms are up, and I'm going to lean into the corner. I want to get a stretch where I've just released that muscle. I'm going to hold for 30 seconds, and then I'm going to come out of that. If I get symptoms, I want to come out immediately and then go back in for the stretch. So one of the tests that I'll do to check for thoracic outlet is called a Ruse test. And that's where you stand with your arms up like such, and you're gonna just make a fist and then open your hands. And you stay here and you do this for 3 minutes. It can be quite tiring, so it's not the most comfortable. If you open and close your hands for 3 minutes and you start to get those symptoms of numbness or tingling in the hand, that can be an indication that you have thoracic outlet. So when you do the stretch, if you produce the symptoms, come out of this stretch, let the symptoms subside, and then go back in. You're slowly trying to elongate that muscle so that you are then allowing the brachial plexus to not be compressed from the tightness or the tension in that pec minor muscle. So yes, when you're stretching that muscle, it can be pressing against the brachial plexus, and you want to, over time, like I say, elongate that muscle. So that's my pec minor, release and stretch. And then what I want to do is release and stretch the scalenes. So my scalenes are going to go from the front side of my neck. And if you can picture a triangle here, so if you look kind of on the back side where you have your muscle that's on the top there, that's going to be my upper trap. And I want to come right in front of that. That's going to be your posterior scalenes. So I'm going to be more on the inside here. So it's in that triangle, and you can see when you tilt your head to the side, that's going to be my sternocleidomastoid muscle that's popping out there. And then right behind the collarbone, behind that, in that triangle are my scalenes. So I'm going to take my fingers from my opposite hand, and I'm going to gently press behind the collarbone, and I'm going to press into those muscles and just hold. Now, if I'm on a pulse, I want to come off the pulse. You don't want to be pressing on an artery or a pulse. So you just want to press where you can feel any tenderness, tension in the muscle. And what I'll do is look up and away as I'm applying pressure to those scalenes. So I'm finding my collarbone, my clavicle, and then I just take my fingertips and go right behind there in the front, inside where my anterior middle scalenes are. And then I'm just going to press in as I look away. And then I'll come back to the center. And I'm just wanting to release the tension on the scalenes and the fascia. And I can do this and work on this area for 2 minutes or till I feel a reduction in that tenderness there. So I want to work on my scalenes. And I can go behind my sternocleidomastoid. So I can work my way to the front side. But I'm not a huge fan of that because you want to make sure that you are not on your arteries or any pulse. But if you can feel the muscle and its tenderness, then you can work on that area to try to reduce the tension. And you want to go really slow. So when I take my fingertips, I'm just going to gently sink down and behind there. And if they're compressing on the brachial plexus, then usually those scalenes can be really tight. So you want to be mindful about being gentle when you're working in that area. After you release the scalenes, then I'm going to stretch them. What I'll do is make a V with my hand, go right over my collarbones, and then I'm going to take both hands, kind of pull my collarbones down, and then I'm going to look up and away, or if I've worked on my left side, I'm going to look up and to the right. If I've worked on my right side, I'm going to look up and to the left, and you'll feel a stretch right through the front side there where you just release those muscles. And I'm going to hold that from anywhere from 30 seconds to a minute and then come back to center. So that's my release and my stretch for the scalene muscles. Those are the two main culprits to thoracic outlet syndrome and those symptoms into the arm. It's going to be compression on the brachial plexus from either the pec minor or those scalene muscles. Now, after I've freed up those tension in the fascia and the muscle in those areas, I then want to floss the nerve. And what that does is it's just going to mobilize the brachial plexus and the nerve bundle so that it can free that nerve up so it's not constantly staying smashed, so to speak, between the tissues. It's allowed to move back and forth. To do that, what I want to do, so if I'm going to mobilize my right median nerve, if I've got symptoms on my right side, I'm going to stand and I'm going to place my hand with my fingertips facing backwards. My elbow is straight, and then I'll tilt my head to the side, to the left. When I do that, it should feel kind of nervy in that arm. And then I will bring my head back. So it depends on where you want to do this. You can use your head tilt and then come back. I can also bend my elbow to take slack off and then straighten it to put the tension on. So what I can do to floss the nerve is I can bend and tilt my head to the right, straighten, tilt my head to the left, bend and tilt to the right, straighten and tilt to the left. This takes the tension off. This puts the tension on. This takes the tension off. This puts the tension on. And I want to hold for about 5 seconds, not for any length of time. I just want to continue that movement in order to floss that nerve, and I'll do that about 20 times. It can be really irritating to the nerve if it's being compressed, so you want to be mindful not to overdo it if you feel like it is flared up and is increasing the symptoms. But over time, if you release the tension and the compression against that nerve bundle and free that up, then that can help you, the nerve do its job by getting the signal and not being compressed and resulting in those pins and needles and numbness that you get from compressing a nerve. So that is my approach for thoracic outlet syndrome in order to address the main culprit to what produces those symptoms. And if it is successful, then the symptoms should start to lessen. So definitely seek help if you've got symptoms and need to be assessed for what the source is for your symptoms. So I hope this is of help, and have a blessed day. Thank you.